Nursing is a critical profession in the healthcare system, focusing on patient care, health promotion, and disease prevention. Nurses play a key role in supporting doctors, providing direct patient care, and educating individuals on health management. Roles and responsibilities of nurses. Nurses have diverse responsibilities, including 1. Patient care, monitoring patients' health, administering medications, and assisting with daily activities. 2. Health education, teaching patients and families about disease management and healthy lifestyles. 3. Collaboration, working with doctors, therapists, and other healthcare professionals to provide comprehensive care. 4. Critical thinking, making quick decisions in emergencies, such as in intensive care or emergency rooms. 5. Emotional support, offering comfort to patients and families, especially during difficult times. Types of nurses. There are various types of nurses, including registered nurses, RNs, provide general patient care in hospitals, clinics, and community settings. Licensed practical nurses, LPNs, assist RNs with basic patient care. Nurse practitioners, NPs, advanced practice nurses who can diagnose illnesses and prescribe medications. Critical care nurses, work in intensive care units, ICUs, to manage severe conditions. Pediatric nurses, specialize in caring for infants and children. Importance of nursing. Nurses are essential for maintaining public health and ensuring patients receive quality care. Their expertise and compassion help improve patient outcomes, reduce hospital stays, and enhance the overall healthcare experience.